Maternal health as a theme was identified as a priority area by the senior leadership of the Ministry of Health and Social Services. We therefore assembled a team of multi-stakeholders called the Maternal Health Initiative to address issues relating to maternal health. Transport services, especially emergency transport services, was identified as one of those areas. The prototype as a proof of concept was developed by the participants of the Maternal Health Initiative together with the people in the system as a way in seeking local and sustainable solutions for improving the lives of the people in Namibia, especially the mothers due to give birth.
Now we have a very positive change in this station, and there is a huge satisfaction in our job. We can see that change can happen now, that it wasn't always like that.
We were really struggling because we were using the ambulance not for the purpose what it should be used. We were transporting walking patients with an ambulance, which is meant for emergencies.
There was no monitoring system.
The communication with management was very quiet.
In the beginning, we have realized that the ambulance services were not up to standard in terms of inadequate ambulances and the other infrastructure like radio communication, telephone services, as I already mentioned, the administrative support services which were lacking. That has caused that ambulance men had to run around to perform all these tasks and had subsequently neglected the actual services, the rendering of ambulance services.
In our initial sensing or diagnostic phase, we used different tools, and just to name some of them was like waiting time analysis in the clinics, ambulance utilization, logbook analysis in terms of how many cold cases, how many emergency cases they've seen, and then also the workload during the day but also over a week, and also a process mapping to know where the process bottlenecks are and how the process looks like end to end.
We also realized that the budget provision was inadequate. We approached the Ministry of Finance and more funds were allocated for the procurement of more ambulances for the entire ministry.
We received some new vehicles. We have a vehicle that is transporting patients between all the clinics that we have in Windhoek. And also we have a vehicle which is transporting cold cases between the two hospitals. Now the ambulances are just meant for emergency transportation.
Currently we have got a combi that's making rounds 4 times in the clinic, 2 times in the morning and 2 times in the afternoon, which have lifted the burden of patients' transport referred to other facilities.
The services really has greatly improved, and we're happy that the ministry have tried to introduce the bus for the patient system for the cold cases.
We were able to see, the time frame. Our ambulances will now be used for what they are expected to, whereas previously ambulances would be sent out there for even lesser or cold patients, who does not need ambulances. But now ambulances are able to be sent for real patients.
We have reduced the response time by having equipment which we use, because the new vehicles that have come in and the ambulances respond only to emergencies, so we don't waste the time in terms of transporting other patients.
The radio systems are functioning, and the clerk has been appointed. And what we also realized is that the morale of the staff was very low. But from now you could see their job attendance has improved. They are more spontaneous, and they also they're giving us their cooperation with regard to keeping of statistics and the movement of ambulances.
There was minimal cost involved in terms of these changes that has come.
When I heard about the changes taking place and new things coming in, I was very positive because I thought that it was a good thing happening.
In terms of the attitude of the ambulance unit staff, their behavior, their disposition, the mood at the actual unit itself, that's changed significantly in the sort of 7 or 8 weeks that I've been here, and probably even more so if you look at the point where we and Sabina initially got involved, and that's something we hear anecdotally all the time.
We can see now that there is a change in the leadership quality, because we have seen the permanent secretary have come to visit us at the station, and the minister also have come to visit us at the station, and we feel very good about that.
The professional relationship between the medical staff and the ambulance drivers, before we didn't have such a good relationship, maybe because they were also stressed. They were having only one ambulance and they must go everywhere for emergencies, for cold cases, so it was not so good. But now you find that the guy will come, sister, in every room, is there any patient? Which is a very good thing.
The interaction that we had with nurses and the other health workers before was not clear, because there was many misunderstandings in terms of duty, lines of duty.
Is there anything I need to know?
After the intervention, it improved a lot, to an extent that even also management which did not understand then, have improved the understanding of how ambulance service operates.
The system is very, very better. The communication between the various nurses at the health centers and clinics is very positive. We are now we are working together as a team now.
The relationship between the driver and the nurses improved also very much.
People, they now see what is our work, what we are doing. It's very important. So that's why I'm feeling like we are now counting. We are someone.
After all these changes that have happened, I can now feel that I am doing my job the right way.
What I think about the synagogues, the one big difference they brought in our midst is that I think that they are a life-saving organization. They are not doing it for us per se, or for the ambulance station. They have done they have done something good for the whole of the community of our society.
It's better, it's good for us. It's better for the service. It's helping us out, and if we don't have even taxi money, we can work by feet slowly, and we can come at our place.
We are very happy with the outcome of the prototype, and yet we are keeping our eyes on the ball to ensure that we address any issue that may arise in the future.